This Good to Go segment is sponsored by Spectrum Health Medical Group.
During the COVID-19 pandemic, there's been a lot of talk about social distancing, but not so much conversation around the impact and the stresses that it puts around those with substance use issues, with group meetings and therapies having to be remote, and things like alcohol sales increasing. There are a lot of stressors for these folks, and here to talk a bit more about that is Spectrum Health Clinical Operations Specialist Jodie Sling. Good to have you here, Jodie.
Good to be here. Thank you.
The stresses are real, aren't they?
They are. They really are. Our concern in the addiction medicine area is that there's a lot of studies that have been done, but one of the most classics is that when we are separated and feel isolated, our substance use goes up. And then when we feel like we're connected to people and we're able to get back out again, then the substance use goes down. And like you mentioned, alcohol sales are up about 50%. So we're not sure if people are safely using it this time or not.
Well, you've given me an exhaustive list of the stressors that people are experiencing, and that isolation tops your list. Desperation can often accompany isolation, right?
Correct. And some of the stressors that people aren't realizing is what's layered on top of our young parents who are doing their jobs at home and educating their children. And perhaps they're even sandwiched with having older adults they need to take care of that they don't have the time or the ability to. Add that into the pieces of having financial hardships, even food securities, and you start adding up a lot of reasons that people would want to feel like they can escape from it.
Yeah. You also list a lack of social support. If you've not got a good structure around you, especially as we're all locked away in our homes, that's tough.
Yeah, that is a really, really tough one too, because if you're not good with technology, or if you're not still continuing some working interactions, you might really feel like you have no one to turn to.
You ticked off some of the things that some parents are having to do with the educating of the kids and doing their jobs maybe at the same time remotely. And yet, even with all of that, a bit of a lack of structure, that structure helps people keep it together, right? And when that's gone, there can be this trouble, right?
Yeah, I think during this time we're deciding that there's like two different complete camps. Either you have a full-time job and a full-time job and maybe another full-time job, or you can get up and be in your pajamas binging TV all day long because you don't have anything that's requiring your time. So it's hard for those two camps to relate to each other, but they're both stressors in different ways, whether it's too much to do or not enough to do.
Yeah. Depression and anxiety, they're real in times like this, right? And exacerbated by the circumstances.
Yeah, we highly suggest that you keep your media intake to less or just a little bit to stay up on the things that are necessary for safety, because there's a lot of conflicting information about there and a lot of angst that can be caused by that.
All of the layoffs, the difficulty getting into the unemployment and having access to that system, financial insecurity is another big stressor.
It is the perfect storm for people to want to not feel their feelings right now, which can be, tempered by using either alcohol or drugs. And I don't think anyone could plan this or be prepared, but we really want everyone to know that Spectrum Health is still available to them. And we have a special access point that people could get into if they feel like they're struggling.
Yeah, tell me about that.
So we have a Center for Integrated Medicine. It's an office where all we do is substance use disorder treatment. And they have not closed at all. We've followed guidelines. We're able to safely give care, still taking appointments and bringing in new patients. And we just want to make sure everybody knows that we have access. And then for those who maybe aren't part of that system, there's a lot of other access points all through West Michigan that we'd love to share.
Yeah, you've put together a beautiful list of additional resources, and I'm going to put all of that onto our website so that folks can access whatever it is that they're needing. You help with everything from, where to ask questions about your finances to, finding healthcare and counseling. So thank you for all of that, Jodie. I appreciate you spending time with us during these difficult times for so many.
Well, thanks for helping us get the word out. We really hope that we can help people.
Glad to do it.
You bet.